Now, the Prime Minister has always said that the NHS is safe in his hands, but his government's reforms of the health service have been controversial, especially the use of the private sector. Today, people campaigning to keep NHS services in-house paraded a petition of more than 5,000 signatures through the streets of Bristol. Our health correspondent Matthew Hill looks at the arguments for and against privatisation.
A noisy political protest, reinforcing the idea that the NHS is the election battleground. Well, all the parties here at Westminster are promising the NHS is safe in their hands, but depending on who wins, how will the health service look in the West? Labour wants the NHS to be the preferred provider and to cap private sector profits. The Conservatives don't mention the P word in their manifesto, although their health reforms have freed up the NHS to outsource more work. The Tories accuse Labour of hypocrisy, saying they introduced these private contracts so enthusiastically in the first place. Labour paid over the odds for private treatment centres like this one in Shepton Mallet, although these days they get the same rate for operations as the NHS. But this partnership with the private sector also brought in innovation. Swabbing patients here before admission virtually eradicated MRSA. Every NHS hospital is now doing the same. And one think tank says we could go much further.
Privatisation might actually help the UK move towards a system where more people are getting more efficient services. All the UK has to do is look to its European counterparts, look to Switzerland, look to Denmark, look to the Netherlands, see that they are getting better patient outcomes when the government is responsible for funding healthcare, but not necessarily responsible for providing that healthcare.
Maybe, but at what cost? Dr. Gabriel Scally was in charge of public health in the West and now advises Labour on health policy.
One of the ways in which the NHS can save money is by stopping all this market activity, all of the finance activity, all of the contracting, the legal fees, etc.
But many would say the private sector has brought efficiency to the NHS. It's made the NHS raise its game.
Well, I think some of that additional capacity has been very helpful. There also have been unfortunate episodes with the private sector.
Last year, the NHS here cancelled the contract for a private provider to carry out cataract surgery. More than half of the 62 patients involved reported serious complications, and the NHS had to pick up the pieces. But whether these campaigners like it or not, the private sector has always been involved in the NHS. GPs are private businesses, after all. Who wins in a few days' time may decide how far that goes in the next 5 years. Matthew Hill, BBC Points West, Bristol.